Hello, my name is Kayla Myers. I'm a fourth-semester nursing student at Craven Community College, as well as an ARIBN student at East Carolina University. Today, I chose to talk about the Joint Commission's position statement on workplace violence and incivility in nursing. There has been a huge increase in workplace violence and incivility, and we see this all over our social medias and news platforms. These incidents not only affect the well-being of nursing staff, but it also affects the patient care that we provide and the safety that we provide our patients, and it shows us what future nursing could look like in our clinical settings if it's not solved. The Joint Commission's position on workplace violence and incivility is a zero-tolerance policy. They define workplace violence as an act or threat occurring at the workplace that includes verbal, nonverbal, physical, and written aggression. They include threatening, intimidating, harassing, use of humiliating words or actions, bullying, sabotage, sexual harassment, physical assaults, or other behaviors of concern to our nursing staff, our licensed practitioners, our visitors, and our patients. The Joint Commission requires that hospitals have preventative strategies, like a program that provides education, training, and resources for all staff on workplace violence. They also require the implementation of policies and processes to prevent and respond to violence, report incidents to analyze, provide support to our victims, and create a solution to mitigate or resolve workplace safety and security risks. My reaction to the Joint Commission's position statement on workplace violence and incivility was favorable. I'm glad they recognize that workplace violence is not an inevitable occurrence and that it's preventable, that there are strategies that we can create and use to prevent these violences against our nursing staff and our patients, to create a safer environment. And I appreciate how they provide resources for healthcare organizations to utilize and include links to other resources, like to OSHA, which is a prime example of how safety is implemented in our workplace. Their position underscores the need for change to create a safe environment for both healthcare workers and patients. My experience with workplace violence and incivility occurred as soon as I started working in healthcare. One example that has stuck out to me that I witnessed was a physical assault from a patient to staff members who were trying to stop them from getting to another patient. I've also witnessed incivility between nursing staff because of a miscommunication and disagreement. And unfortunately, these situations are not a rarity and occur more frequently than we think. Previously, the Joint Commission's statement regarding workplace violence and incivility did not encompass bullying, sabotage, and other forms of retaliation. This weakness was recognized, and they changed the definitions in hopes of combating other forms of workplace violence. They hold organizations to a standard of accountability for prevention against violence and incivility by having them create training and education. They encourage these organizations to promote an environment where reporting does not result in retaliation. The Joint Commission could provide more specific strategies that organizations could utilize instead of leaving it up to the organizations, and they could provide tools for analyzing how those strategies have affected workplace violence and incivility. From my own learning and experience, I think that there should be quarterly training on workplace violence and incivility that addresses strategies for prevention, de-escalation, and recognizing signs of potential upcoming situations. I also believe that there should be monthly meetings with all staff on a floor that addresses any issues and provides constructive feedback on what is working and what is not. And I think creating a schedule that has adequate staffing to prevent extra stressors would help prevent incivility. Workplace violence creates more problems than needed and ultimately risks patient safety and staff safety. We choose the Joint Commission's position as a foundation for our approach to decreasing workplace violence and incivility. Nurses need a safe and nurturing environment to flourish in their practice. Thank you for listening to my perspective on workplace violence and incivility, and thank you for allowing me to share this topic.